Okay. So peer support sessions have been running for a while and include invited attendees from all completed cohorts. So welcome everyone, it's really lovely to see you, and a real special welcome to those who have just recently completed the programme, and this may be the first peer group session that they're coming along to. So participants have told us that the opportunity to connect with colleagues across the country is an important aspect of our programme. So we're keen to take this forward, and peer group sessions will, as far as possible, be held quarterly and feature a short informative input with opportunities to go into breakout rooms to discuss the information shared and your thoughts and opinions on the topic. So these sessions are to support you and your improvement journey. So today's session is implementing and sustaining good practice, and where we will also have a look at the newly reviewed and released management of medication for daycare and childminding services guidance. So I'm sure we as a team need no further introduction. However, today we are pleased also to be joined later by Anne McIntosh and Dr. David Marshall. So Anne McIntosh is a team leader from the scrutiny teams, and David is our Senior Improvement Advisor in Pharmacy from the Health and Social Care Improvement team. So both Anne and David, along with many stakeholders, have been instrumental in reviewing and updating the management of medication in daycare of children and childminding service, which was released at the end of last year. So now let's think about what is the meaning of good or best practice. So the Oxford Dictionary defines best practice as commercial and professional procedures that are accepted and prescribed as being correct or more effective. Commonly, it is a practice that has been proven to work well and produce good or better outcomes, and is therefore recommended as a model. In every field, you can use good practice guidance to quality assure your service and improve the quality of your provision. So good practices can transform over time within any service or business with new ideas or when new ideas surface. For example, the Care Inspectorate and Education Scotland, as well as many other stakeholders, consistently update good practice documents to ensure that they are assisting services using them to be able to review their own service and provide the best possible outcomes. In early years services, good practice guidance and practice notes are important because they help services develop highly effective processes to ensure good outcomes for children and their families who use them. And we know that every service puts guidance into practice in different ways and can succeed in doing this. So let's start by thinking about your own service and how you find out about new documents and keep up to date with any changes and share good practice within your team. So there are many ways to find out about new practice and updated practice notes. So let's go on and have a think about and share how we do that. So first of all, we wanted to know, and we wanted to find out about, we wanted to know how you find out about good and best practice documents. So to do so, we are going to do a poll, and we are asking, how do you find out about good or best practice guidance? Do you use social media, provider updates, the Care Inspectorate website? Does your local authority keep you informed, or are you accessing information from other professional bodies? Or is there another way that you use? And if there is another way, I know we can't add it into the poll, but if you could add to the chat which way you're using, that would be fabulous. So social media is quite popular. as is your local authority sharing things with you. And that's great to hear that local authority share some of the good practice with you. And I see that provider updates are quite helpful for people. Networking we've got, and care inspector at local authority. And some people have got a mix. So there's a mix of website, local authorities and social media. And here's the manager at Kirkbrae saying that she subscribes to emails for when new documentation is released so that they come straight to her. That's a great idea. And it's good to know that some of these services with these good practice documents do have the emails that keep you informed. The Care Inspector website, yep, that's a great time. And for research, GPT is helpful. Oh, that's a new one. I know about GPT, but I don't really use it much, so that's great. Colleagues are always good, and I think if you're meeting as groups and local groups, it's good to just sit down and think what documents are people using? Is there any new documents around that you've maybe missed or that you'd like to catch up with? And Google Gemini also rounds up practice well. Oh, there's a new one. I don't know about Google Gemini. I'll have to have a wee research into that. And Isabel saying that although she could only select one option, and I think that's probably one of the issues here, that you're using most to do it. And that's great. And I think one of the reasons we wanted to put these up is just to let you know that actually there's quite a lot of ways of gathering information about new documents. So if there's any that you've not thought about, hopefully you'll get some here. But I'm just looking back and I can see that the local authority are the one that stood out the most for you in terms of keeping you up to date, which is great to hear. It's good to know that local authorities share these documents with you. Okay. Okay, thank you very much. And I'll pass you on to Hilary.
Thanks, Linda. So it is important that you give yourselves time to seek out and consider good or best practice documents. You also need to be aware of documents which have been reviewed and are updated to ensure you are using the most current and relevant practice to evaluate against. Updated documents are often a good prompt and opportunity to review your current practices. How do you make sure you know when a document has been updated or reviewed? And how do you ensure that all of your team are aware of this? So we've discussed the benefits of good and best practice guidance, using them to evaluate your practice and ensuring that you know when documents have been updated or replaced. So now we'd like you to think about how you currently implement good practice within your settings. So we're going to scan the QR code to share our thoughts on a word cloud, and I will now hand over to Leslie. Thanks, Leslie.
Thanks, Hilary. Okay, so if everybody's got a phone or iPad handy, if you would like to scan the QR code, that'll bring up a question for you to pop your thoughts into. I'll leave it up there just for another wee second to let everybody get a chance to scan it, and then I will bring it down and pop the results on for everybody. So I am going to stop sharing this now, but please don't worry if you've not had a chance to scan it. If you had to nip away to get a mobile phone or something, the QR code will be at the side of the screen in a wee moment.
And that gives you a bit of time to think. So the question is how you currently implement good or best practice. Okay, so we have staff meeting discussions to kick us off. Training courses. Room observations. Oh, they're all pinging in now. Training's a biggie in the middle there. In service days, I caught.
Got role modelling I've seen there.
Yep. Professional dialogue.
I'd love to join in,
loads.
but I just can't. My eyes won't pick them up when they're moving like that. Peer assessments, training nights.
Monitoring and coaching. Yep.
Mind mapping was one which caught my eye there.
Oh, that's a good way to
Yeah. Robust
get people.
policies I saw as well. Yep. Online resources, support and supervisions. Observations, senior meetings, staff meeting, group chats. Children's voice. That's nice to see that in there. That, yep, absolutely. It's really important to capture what their experience and thoughts are. Wow, great to see so many different ideas in there. One-to-one meetings. Induction procedures. Yep, very important. Quality assurance, auditing. Peer
Teamwork.
and self-evaluations. Sorry, Vicky, teamwork.
Sorry,
did you say?
teamwork is one that came
Yeah.
in there. And now they're dancing again for me, so.
Yeah, they do. They shift around, but
But
parents'
isn't there a lot of different?
newsletters.
Isn't there a lot of different ways that people are using?
Yeah,
It's
such
fabulous to see.
a great variety. And again, you think the benefit of this, being able to come together and share all these different ideas, then you'll go away from here with, oh, there's a different idea I perhaps hadn't thought of. Room leaders, information sessions, calendars, so much on there. That's fantastic to see. And I think that the bit to remember is obviously we've looked at identifying when there's new information, how you share it, and then how you implement it is slightly different from how you're sharing it. So sharing it is making sure that everyone is aware of it. Implementing it is about that monitoring of practice. So how have you taken that information and changed practice within your setting? So some, things like observations, monitoring, coaching, etc. That's the ways that you would be able to observe in terms of what has been implemented in practice, but the starting point is that you need to be able to share the information. So thank you everyone, loads on there.
Yeah, this will be available on, that will be available on the hub, so you can always go back to it and just have a think about what you do and what others do that might complement what you're already doing.
Yep, we'll make sure we share that out. Okay, so thank you for all that. So let's now reflect on your role as leaders. How do you, as a leader, use guidance to ensure your team are confident in using best practice? Okay, so we've shared some ideas there, so have a think about that. As we know, being aware of what good practice is only the beginning of identifying what your own service should look like for children, parents and staff. Sharing this with your team and evaluating your own practice against this is crucial to identify where you are now and then identify any changes you need to make to ensure practice is in line with the guidance. If we think back to your work on the ELC Improvement Programme, following the steps of quality improvement methodology will help you identify the changes you need to make in line with good and best practice guidance and then implement these in your settings. You and your team should have a shared vision of where you want to be. As we know, in order for us to make changes and improvements using guidance, we must initially understand our current ways of working. Ask yourself, where are we now? And remember, this is your starting point or baseline. You can find out about where you are now through observation, review of an area, reviewing current practices, policies and procedures, informal discussions, questionnaires, surveys, etc. A lot of the ideas that were shared on that word cloud. So things to think about. Exactly what happens now? What does it look like? What is the guidance telling us? Is there anything new? What do others understand or do? What are people saying about their experiences? And remember, this includes children's parents, staff, and stakeholders. Remember that importance of gathering everyone's perspective. And then what is missing? What, if anything, needs to change? Gathering this information helps give you a good starting point and a clearer idea of what needs changed and improved, and you should use this method against any good practice guidance or practice notes. So once you have gathered this information of where you are now and what needs to be improved, you then need to make a plan. Have your aim or vision in mind and consider what needs to change, who needs to be informed, and who needs to be involved. Help staff, parents and children understand any changes. Remember, when people understand the why behind the change, they are much more likely to get on board. Thinking back to improvement methodology, this is about your PDSA cycle and testing your change ideas. And this is a good time to reiterate to you all that small changes can make a big difference. Starting small with your tests of change allows you to identify what is working and build on this to achieve your overall aim. Help staff to be confident testing changes and using guidance by supporting their learning and skills. Involve everyone in the study part of the cycle to ensure you gather all perspectives and experiences. When you find your tests of change have been successful, you can then adopt and implement the change. This is about embedding the change in line with the good or best practice guidance into your everyday practice and then sustaining this across your setting. It is important to keep up to date with any further changes to best practice through your quality assurance systems. Have you already built this into your quality assurance systems, or is this something you will now take forward differently after this session? And I'm going to hand back to Linda. Thanks, Linda.
Thanks, Hilary. So let's put this into some context by looking at one of the most recently updated good practice documents produced by the Care Inspectorate, which is the Management of Medication in Daycare and Childminding Services. And today we are really lucky enough to have two authors of the updated document, Anne McIntosh, who is a scrutiny team manager, and Dr. David Marshall, our Senior Improvement Advisor for Pharmacy. And they're here to speak about the document and answer some of your questions. Anne, David, I know you're here, and I'll hand over to you now.
Thanks very much. Anne here as well, yeah.
Anne's here, yes. Oh, we can't hear you, Anne, if you're speaking to us. Oh, I don't know why, Anne. Why we can't hear Anne? Oh, she's got the blue screen, David. So could I leave that to you, or are you needing?
No, it's fine. I'll just give a very brief summary of why we updated the guidance and talk through very briefly about it.
That's great, thank you.
On the guidance for medication in early years was, I think, originally around about 2004, and then it was updated in 2009. The version that was previous to this one was 2014, and I think the timing of that was actually just a bit unfortunate because not long after that there were some changes in the law in terms of what nurses could do for certain medications. There was also an awful lot of outdated references in the guidance. Some things went out of date fairly quickly, and we also started to get an awful lot of frequently asked questions from the previous guidance, things that maybe could have been clearer. So the object of this was really, it was to update and simplify the guidance. I mean, not much has essentially changed. I mean, the principles are really much the same. This was really about trying to simplify the guidance and just bring it more up to date and make it more user friendly as well. We did have a full consultation process internally and externally, and we spoke to loads of people, and that was really beneficial, I have to say, and also working with Anne as well. It was because Anne's experience in terms of running services was really good.
I'm here now, David. Sorry,
okay.
I'm joining from a phone. My computer decided to crash just as I joined. But I'm here now. Hi, folks.
That's always the way it happens. So basically, all I've said so far, Anne, was basically why we decided to update the guidance. We knew it was out of date. We knew it needed done, and for various reasons, COVID notwithstanding, but various other reasons, it hadn't been updated for a long time. 2014, and that guidance went out of date fairly quickly. So it was really just about simplifying the guidance, clarifying some frequently asked questions, and addressing outdated references and tweaks in the law. So yeah, as I say, we consulted internally and externally fairly well. You know, team managers, inspectors, chief inspectors internally, and so on and so forth. Externally, we went to various umbrella bodies, and you'll know these better than I. Maybe you want to just mention briefly who we spoke to. Was it?
Yeah, so we involved quite a lot of people in this document. So we involved inspectors across the teams, so including complaints team and registration. We asked team managers to look at it, and more senior staff within the Care Inspectorate. And then we took it external as well, and that was including the CMA, NDNA, CALA, SOSCIN. So everybody got a look at this document, and we also sent it to some local authority and a large private provider as well. So there's been various drafts along the way, and we've absolutely taken everybody's comments on board, because as David said, this document, you know, these things quite easily become outdated and the links weren't working, and it's really important that that document works for you as a provider, that you're able to pick that up and it supports you. So we absolutely took on board everybody's guidance in relation to taking the document forward, and it was really, really useful. And then after that, when we gave it back to them, we then received quite positive feedback about the document. So people seem to like it. I hope it's working for you. But again, we just really wanted to think about the kind of things that we see at inspections to make sure we clarified it within the guidance, and also the things that we are contacted about quite regularly. So that kind of helped us form those frequently asked questions as well. But it's really important to say about the document is one shoe doesn't fit all. It's really important that you look at that document and you see how it applies to your service and how it aligns with your own policies and procedures. Again, I think you were asked earlier, you know, how you implement that good practice, and a lot of you said, you know, that the words jumping out were training and staff meetings. And again, I would say staff meetings and training sessions are the ideal time for you to be able to share that with your staff, because it's really important that, you know, you look at it together and say, well, what does this look like in our service? How does it apply to our service? And talk about it that way to make sure that everybody has a good understanding of it. And it's also an ideal document for using for monitoring as well. So that quality assurance, if you have that guidance and you know, you're looking at how your medication is stored or how the, you know, the paperwork is being recorded, having that document lets you really monitor that. And that's what we look at when we're out in inspections as well. We're referring to that guidance, and that's what we look for based on what is in that document. So it's really good to take time to explore that with staff, as I said. But again, always remember that your inspector is available as well to be contacted. So if you're looking at that guidance and you're wondering how that applies to you, or how it doesn't, you know, quite fit in with what you do, always feel free to pick up the phone to your inspector and have that conversation as well.
That's great. So is that everything you want to say? Are you willing to take some questions?
I'm happy to take questions. Yeah. That would be helpful. I'm just going to try and join on my laptop again.
Okay.
Linda.
Okay. So does anybody have any questions? We'll keep questions quite short, and if you've got anything that we can't answer, we will. If you put them in the chat, we will get Anne and David to answer them. So the manager at Kirkbree, do you want to come in?
Hi there, can you hear me okay?
Yes, we can.
Yes, perfect. We can. Hello. I've just got a question in terms of what your viewpoint is of where medication is stored. So I've worked in a few settings where medication is stored in the office with the manager, and also settings where it's stored in playrooms in a kind of lockable first aid cabinet. And I just wanted to know what is...
Sorry, I never quite heard that last bit. So sometimes it's stored in the office and sometimes stored, was that in the playrooms?
Yes, in playrooms in a locked first aid cabinet. So I just wanted to know which one is better, really.
Okay. Well, I can start answer this and then I'll maybe hand over to you, David.
Sure.
But really you need to think about the type of medication that you're storing as well. So, for example, some of the things that we often see is inhalers. Maybe there's medication stored in an office, and sometimes that includes rescue medication. So, for example, inhalers or EpiPens, and what you need to think about there is how quickly you need access to that medication.
Yeah.
So if that's stored away in a locked cupboard, in the manager's office that's also under lock and key, you've got to think about, who has access to that and how long it's going to take you to get to that medication.
Yeah.
There's different levels of control with drugs, and David can maybe talk a wee bit more about that. But you want them out of reach of children. You want to make sure, that they can access it. And you've also got to think about, that's why I said about there's not one shoe fits all, because you've also got to think about your own building and who has access to that building. Some people run their services from halls or community centres that people might access later on. So again, you've got to think about where that medication is stored throughout and not just while you're operational.
Yeah.
Okay. But again, it's about thinking about how quickly you need that medication as well.
Yeah. Thanks, Anne.
Yeah,
there's not much I can.
Yeah, there's not much I can add to that. I mean, Anne's pretty much covered it there. It's one of these subjects where you can't prescriptively give a one simple answer that will apply to all services, because every single service has different buildings and different setups. But there are some basic principles which you would take on board and apply. Basic principle: all medicine should be kept securely, and if they're in charge of the meds, out of reach of children. There are some meds that you're going to need quick access to, so then the rescue meds need to be stored securely, but also you need to be able to have quick access to them. And there are certain medicines that there's a certain level of control. You don't need a controlled drugs cabinet in these sorts of services, but there are certain medicines that should be under an extra level of control that only the person in charge should access them, not just all of the staff. So it's one of these things. You need to take the principles and apply them yourself to your context.
That's great. Thank you.
Thank you. And Mrs. Lewis has asked, is there guidance around taking children's temperatures?
I don't know if everyone was part of the webinar last night on the infection prevention and control, and that was a question that came up quite a lot. Mm-hmm. So again, I would advise you to go to the NHS Inform website for information on temperatures, because again, people were asking, can children come in with a temperature? What about medication and things like that? Again, it's such a broad question in terms of, if a child's got a temperature, you would be having that dialogue with the parent as to whether or not are they well enough to come to nursery. So,
and I think that's a really good point, Anne, isn't it? That there's other websites and things around, like from NHS and whatever that you can access that kind of information.
There is guidance online on the NHS Inform website, and we have put the link to that into this medication. But again, people ask it because we've kind of made it a bit clearer about over-the-counter medications. And again, that's not to say that you need to take children in because a parent's saying, well, I'm giving you Calpol, and therefore giving them it every 4 hours. Again, it's about that conversation with a parent to say, why do they need this medication? Mm-hmm. And actually, is that telling us that the child's actually not well enough to be at nursery?
Yeah. So Carla-Ann is saying that she has concerns about non-prescribed over-the-counter medication, particularly paracetamol-based products. Do you have any comments on that?
Well, I think that's just what we kind of alluded to there, is about, you know, the reason we talk about that, there is a lot of medications, you know, like maybe teething gels or things like that people have felt, oh, I have to get that prescribed by the doctor and I have to have a prescription label, and things that, you know, parents have the right to decide, you know, their child perhaps needs a medication. But again, that's for you to decide what your policy is. So, for example, some local authorities have a very clear policy that they will only accept medication that has been prescribed by a GP or pharmacy. So, while our medication says there's nothing to stop you accepting that, if that is your policy, again, that's why I was saying you need to look at this medication and have that discussion with your staff and say, well, how does that apply to our existing policies and procedures?
Thanks, Anne. And I think that answers Susan's question as well, which was about nappy barrier cream, which is not prescribed. So yes, it's about your own policy and against, you know, thinking about your own policies in terms of that.
Yeah, it does become a bit more complicated, Linda, and David, maybe you can help me out here if I'm remembering this correctly, but there is some some barrier creams and some sun creams that are medicated and they would be considered a medicine. Am I right, David?
Yeah.
Whereas others are just a barrier cream.
Generally, barrier creams aren't part of this guidance because they're not medicines. So unless it's specifically a medicine or been used for medical purpose, barrier creams are out with they're basically just not considered medicines. In terms of over-the-counter products, there has been an awful lot over the last 10 years about GPs complaining that some people are going to ask that a medicine is prescribed just so that a nursery can do it. So although the local authority are saying they need all medicines to be prescribed, that is at odds with the pressures on GPs and various other things. And the BMA did issue a statement to the effect that these medicines are purchasable and parents can do it for themselves in their own home, and that nursery staff can administer this without it being prescribed by a GP. So that's where the basis of clarifying that statement comes from, because we used to get an awful lot of questions about that.
That's great. Thank you very much. And thank you, David and Anne. That was extremely helpful, I'm sure, and hopefully has helped everyone to see how you use good practice documents and practice notes, and you can use these to review and reflect on your services. And it was a really good reminder, Anne, and I was glad you said it, that these documents are designed for you. And one model doesn't fit all, and you need to sort of implement these documents around your own service, your own policies and procedures, and review against that. And if you've got any issues or questions, then you would come back to the Care Inspectorate or your inspector and ask them.